When we look at an electrocardiogram rhythm strip, our goal is to analyze it systematically. This allows us to determine the patient's heart rate and rhythm, detect arrhythmias, evaluate conduction disorders, and even identify evidence of myocardial ischemia, injury, or infarction. The rhythm strip isn't just about numbers and waves on paper. It's about connecting what we see to how the patient is doing. Let's start with determining the heart rate. A 1-minute rhythm strip contains 300 large boxes and 1,500 small boxes. With a regular rhythm, the most accurate method is to count the number of small boxes between 2 R waves and divide 1,500 by that number. For example, if there are 10 small boxes between 2 R waves, the heart rate is 1,500 divided by 10, or 150 beats per minute. If there are 25 small boxes, the rate is 1,500 divided by 25, or 60 beats per minute. This method is precise and quick once you practice it. If the rhythm is irregular, we use a different approach. Count the number of RR intervals in 6 seconds, then multiply that number by 10. Remember, the ECG paper is marked at 3-second intervals across the top, 15 large boxes. By using 2 of these intervals, you have 6 seconds. Counting the RR intervals rather than QRS complexes is more reliable because counting only the QRS can sometimes make the rate look higher than it really is. The same methods can be applied to the atrial rate, but in that case you measure the PP interval instead of the RR. Now, determining rhythm. The RR interval gives you the ventricular rhythm, and the PP interval gives you the atrial rhythm. If the intervals are consistent, or if the difference between them is less than 0.8 seconds throughout the strip, the rhythm is regular. If they vary, the rhythm is irregular. Once you've analyzed the rhythm, compare your findings with known ECG criteria for arrhythmias to make a diagnosis. And here's the key point. Identifying the arrhythmia is only part of the job. As nurses, we must also assess the patient. Does the arrhythmia affect blood pressure, perfusion, or symptoms? Treatment is based on the patient's clinical picture and the cause, not just on the rhythm strip itself. Next, let's talk about the systematic approach to interpreting arrhythmias. This checklist helps ensure we don't miss anything. First, determine the ventricular rate and ventricular rhythm. Then measure the QRS duration and see if it's consistent across the strip. If not, identify the variations. Look at the QRS shape. Is it uniform or are there different morphologies? Then examine the P waves. Is there a P before every QRS? Is the P wave shape consistent? Next, determine the atrial rate and atrial rhythm. After that, measure each PR interval. Are they all the same or irregular with a pattern? Finally, determine the P to QRS ratio. How many P waves are present for each QRS complex? In clinical practice, many nurses use a printed checklist to go through each of these steps, documenting the findings. Cardiac monitoring systems today can also provide continuous rhythm surveillance, complete with alarms that alert staff when the rhythm changes. While this technology is invaluable, it comes with a challenge: alarm fatigue. When too many clinically insignificant alarms go off, staff may become desensitized, ignore alarms, or even silence them. That puts patients at risk. And here's a quality and safety nursing alert. It's essential that we don't just silence alarms, but actually assess why they're happening. Adjust the alarm settings based on the individual patient, confirm the limits are appropriate, and discuss with the provider whether continuous monitoring is still necessary. Alarm parameters should be tailored, not one size fits all. Doing so helps reduce alarm fatigue and keeps patients safe. In summary, analyzing an ECG rhythm strip is about methodical assessment. Calculate the rate, evaluate the rhythm, check each waveform, and always connect what you see on the strip with how the patient is doing. Technology supports us, but our clinical judgment makes the difference.